Hello, everybody, and welcome to the show. I'm really happy, as I always am, because I always have a lot of amazing doctors, healers, people that serve our community. And today is no different. I'm very happy to introduce today Dr. Holly Durning, who is a doctor of Oriental Medicine and an acupuncture physician who has a story about New York and Pennsylvania and went and came back and had a private practice in the Hamptons. Of course, very familiar with all of that area because that is where I'm from, Long Island, New York. So everybody in New York City went to the Hamptons on the weekends, right, Doc?
That's true, yeah.
Not today, though, not with the snowstorm.
That's true too.
So welcome to the show. Thank you for being here.
Well, thank you for having me.
I'm very excited. I want to give everybody just a little background before you start sharing with us all of it is that you do to help people navigate through their health. Pain management is a specialty of yours, integrative oncology, which I can't wait to hear more about, women's health, trauma, PTSD, autoimmune, and one of my favorites that I can't wait to hear about, cosmetic acupuncture.
That's right. Yeah, very popular.
Awesome. So why don't you just give the audience a little bit of who Dr. Durning is and how you ended up back in St. Pete, Florida.
Well, I've always loved holistic medicine. My undergraduate was right here at USF with anthropology, more medical anthropology. So I always loved other cultures, how they viewed health and illness, different ways to treat the body. And when I was up in New York City, there was a great Chinese medical school called Pacific College of Oriental Medicine. So I started there, was able to intern at some really great places, NYU Hospital, the VA Center, a clinic in Chinatown. So I really saw firsthand how this medicine really helped people, post-stroke, just really sick, and Chinese medicine saved their life.
Yeah, I mean, you froze a little, so I'm going to just continue on. You
Okay.
got new Wi-Fi, but we know how that goes. And we're living a life of Zoom today, so we don't even let any of these things affect us. I was raised in Long Island, and for a few years, I was a director of operations for New York Medical, and we had Eastern and Western medicine. So my first experience was with Dr. Kui, who he would see how stressed I was from the MDs yelling at me. Don't worry, guys. I'm not picking on you, but Dr. Kui would put these wonderful little, what are they called? What's the official term? Beads.
The ear seeds.
The ear seeds.
Uh-huh.
And would just talk to me. And before you know it, I was floating out of his office and could handle everybody that was gnawing at me to help them. So Eastern Western medicine has always been such a passion. I'm so glad that you've brought that experience now to St. Pete. So you were in New York for a while, but you grew up here.
I grew
up. You grew up in St. Pete?
I did. Yeah, went to school, Northeast High School, and USF, and then wanted to spread my wings. And now I'm back to my hometown to treat the community that I love and open up my practice right here in St. Pete.
And what is the name of your practice?
Dr. Holly Durning, Holistic Medicine.
Oh, I love that. So St. Pete is not the same as it once was.
It is not, no.
Which is it's a good thing, we've definitely grown here in St. Pete. It's wonderful. So tell us a little bit about your practice in terms of treating people with pain management and how you integrate all those methods together to help people. I would assume there's some people coming to see you that might be addicted, struggling with addiction.
That's true too. Certainly I treat a lot of pain patients, and that's what most of the time people think of acupuncture for pain, but it treats the whole body. And I have seen too with addictions. And I actually, when I was in Boca Raton, I worked with a Chinese medical office that worked with an exclusive rehab center. So it was a very high end, and we dealt with a lot of addiction, kind of curbing that addictive kind of mind, quieting the mind, helping to deal with stress, helping to deal with withdrawal symptoms and pain, insomnia, anxiety, and everything that comes up with that too.
So I remember one of the most difficult things to get across to the market, to the patients, to the clients, when they heard acupuncture, of course, you've heard this before, everybody's scared to death of a needle. Dare I say more men than women, but it truly is like a hair-like follicle
It
coming
really
at you.
is. Most
Right.
of the time, people who are super scared, I have them come in. I say, okay, let's try one needle, see how you feel. And all the time, really, they're like, that was it? I can't believe I've been putting this off. I should have tried it years ago. And
Yeah.
it's really quite relaxing. I've had patients say it's even more relaxing than massage. They can just lay there, all the natural endorphins kind of kick in, and the body it's calm and it heals, and you're in a relaxed state, really.
Yeah. And I think, well, I know because I've been such a fan of acupuncture for so long, always wanting to integrate with a lot of the MDs and the DOs. And I think it's such a great way to have a real collaborative medicine, a real collaborative community, is to understand the benefits that you provide. So can you tell me a little bit about, because I'm very interested in the integrative oncology?
Yes, certainly. So, a lot of the time when I work with patients going through cancer treatments, we're working to manage the symptoms. So, a lot of nausea with the chemo based drugs, but also just boosting the immune function, helping the body be strong enough to support those harsh treatments. And, sleep is certainly a thing, stress, that can all be part of it. And a lot of the time, where it used to take them days to get over that dose of chemo, they can get going and get back to life a lot quicker with acupuncture. And
Mm.
I've even had patients who, they had gone through the chemo radiation. They don't want to do that. They just want to do natural and just support the body in that process too. So
That's
both.
wonderful.
Mhm.
Yeah. And you have some experience with Sloan Kettering as well, right?
That's true. Yeah. I had an advanced certification through Sloan Kettering for treating cancer patients.
Where I actually have an uncle in New York there right now. I know that when we were first, supposed to do our interview, my uncle had passed away and I just heard about it and I was in no frame of mind to have a conversation. But, cancer runs rampant through so many families, certainly mine. And, I feel silly, foolish actually, to have such a love and a passion for acupuncture and never think that this could be a treatment that could help somebody through whatever, their chemo and their pain, their nausea. It's such a wonderful value add for them.
Yeah. And even neuropathy, that's a big thing too. A lot
Mm.
of patients recovering have residual side effects of neuropathy, hot flashes, and acupuncture is very helpful.
All right, so let's move on to a little trauma and PTSD.
Yes.
I have a lot of police officer friends in my life that I refer out a lot to, whether that be a psychiatrist or TMS, lots of PTSD, a large veteran community here in the state of Florida, of course, all over the place, but we really do have a huge population here. We love our veterans. Um, can you talk to us about some of the patients that have come in to see you that suffer from trauma, and how does Oriental medicine and acupuncture help these patients?
Oh, for sure. Well, I interned at the VA hospital in New York, and I would have vets come in, for pain, but then we were treating other things. And I had a vet, actually cry to me and say, I didn't know I could feel this way again. Thank you so much. I'm going to tell all the other guys. But, it's dealing with, he was disabled. He had a young child at home, and, the stress and PTSD around that, and just the anxiety and the insomnia. It really helped to balance the body. With Asian medicine, a lot of the time we treat emotions through the organ systems.
Mm.
So it's not a separate mind body, it's all interrelated. And we can help balance some of those emotions that come up through treating organ systems.
Yeah, you made me think of, I have a psychiatrist client and friend in Sarasota that does alternative psychiatry, and he has a psychologist and a massage therapist that help patients through trauma.
Uh-huh.
So there's, sometimes when people have experienced trauma, they just think psych or, therapy. They don't necessarily go right to acupuncture. So
And the
um,
body holds on to that. And
yes,
sometimes you don't even know how to release it. And I've had patients cry on the table just to
yeah.
kind of release that trapped trauma that was there.
You are so right about that. I want to share a personal little story about that, just to bring some light to it. When I wrote a book about mental health, And when I released it, I was really experiencing it because I had to reflect back on a lot of the trauma I had once experienced. And I went to get a massage
Mhm.
right after I wrote the book. And I cried on that table the entire hour. And she, she had I told her, I said, listen, this is what's happening. It's not you. This feels fantastic. But I really didn't understand it until I experienced that myself.
Yeah.
It was so helpful to me. I've since done that a few times just to work it out, because you're right. To have it trapped in the body it has to leave.
Yeah. Yeah. And it's interesting. I had a patient recently that had digestive issues, and for years, digestive issues. We started working on that, and it brought up some of this repressed trauma that she had in childhood. And then she was able to kind of deal with that, and it helped her move through her digestive issues.
Mm, I
Yeah.
love this. All right. I have to help our audience right now with some cosmetic acupuncture. This has really floored me a little bit. I don't know why I'm not familiar with cosmetic acupuncture, but this must be a thing. I've obviously put the cosmetics to the side while I think all of us have lived in our sweatpants for a little too long through this pandemic. It might be time to start, getting back in there and fixing, what are these, the 11s? Is that what it's called,
Yes,
right?
yeah.
The frown lines in
Definitely
between.
help you with that. Yeah.
Okay, good. Let's hear about that.
So with the facial acupuncture, cosmetic acupuncture, you're treating the body, which also can help treat the face. So you're treating the organ systems involved, helping lymphatic fluid move, but also bringing blood flow and energy to the face. So you're not only diminishing fine lines and wrinkles, but also evening skin tone, helping to tighten and lift the muscles too. So I do a lot with that, lifting the jowls, even eyelids too. So I've had some women that, just kind of droop a little, it bugs them. We can lift with the acupuncture needles. And
Okay, fascinating. So how many treatments does one need? Let's just use me for an example, right? So I'm going to show the audience this. Okay. Now I don't walk around all the time going like this. And for anybody who's listening and not watching, I am making a frown face, and you can very obviously see these lines. It's the only place that I've ever gotten Botox. But I am a firm believer in integration, and I love to hear about new things. So how many sessions would it take for somebody like me?
you might see some changes pretty quickly, but typically a protocol for the face is
Mhm.
5 weeks, because
Okay.
that's the time it takes for the skin to reset, the matrix of the skin to reset and change. So you're building up collagen and elastin, but in order for it to kind of take effect, you need that 5 weeks. And then I have some patients who really like the changes and want to keep working at it. So they might go a little longer, or then we just do boosters, once a year or something like that. But especially that area between the eyebrows, that correlates to more liver imbalance in the body too. So the liver not only processes all of the toxins in the body, but also all of our emotions get processed through the liver. So stress, you might tend to frown a lot, when you're stressed or irritated. And so kind of working on that to help balance the body so that doesn't happen as much too. So
And what about the time frame of how long it lasts?
everyone is different.
Right.
So if you're younger, in good shape, heal quickly, it might hold longer. But if you're a little on the older side, not so healthy with your eating, or on a lot of medications, it could take a little bit longer.
I love it. I can't wait to have some acupuncture, cosmetic acupuncture.
Yeah.
So I've been asking everybody because I spent all of 2020 doing 3 shows a week and talking to all of the healers that I could get my hands on to help our community. We've all gone through this really difficult time together. I'm almost tired of saying that, almost, but it's true. We're still in it. My parents just had their second vaccine yesterday, so it's a huge celebration in our family for what's to come in the future. We're starting to go on the upswing a little bit, but I'm very curious to know, with everybody that I talked to today, what has 2020 taught you?
Resilience and being open-minded. You never know what's around the corner. I had no idea. Actually, 2020, I was up in Pennsylvania still, and I had talked about moving back to St. Pete, my hometown. This is where I really want to open a practice. And when we were shut down, I had a lot of time to reflect and think about, okay, what should we do? And my husband can work from home. So we said, okay, now is the time for me to really concentrate on my business and my practice. So I came back down to St. Pete, and just things started falling in place. I remained open and okay, how do we do this? I started with a small space, not knowing what was going to happen here. Am I going to get shut down here? And it's just grown. I've had people reach out, people still need healthcare. A lot of things have come up, anxiety, stress, not being able to sleep, as well as pain and everything else. So I count my blessings. I've been healthy and been able to help people. So that's
amazing. I love it. I also am always curious to know why somebody went into the business that they went into. And although we don't always like to think about medicine as a business, it is. So what was it that made you choose acupuncture, first of all, and then to be in business on your own?
Well, like I said, my undergraduate degree was more medical anthropology. So I thought, okay, I started with the USF after I graduated, doing research on grants and things like that. I like more people-to-people interactions. So, I was up in New York. I was in the hospitality business. I love being around people. And I thought, okay, how can I treat patients, or, what can I do? And that's when I discovered acupuncture. And there's a lot of studies that support acupuncture, Chinese medicine. So, I chose that field in the holistic realm of different modalities. And I love it. My scope is very big. I can do a lot of different things, especially here in Florida. I do micronutrient blood deficiency testing too, vitamin injections. That's all part of it. And yeah, I just love helping people. So yeah, I have people who come in. I can work them off medications. I work with kids that have been on inhalers for asthma, and they go to their doctor and they want to up the dose, and their mom's like, well, I don't know, she's 12, and I was able to get her off her inhaler. She's playing volleyball. So just to get kids off medication, stop that cycle early is great. And just be able to support them naturally.
I didn't know you treated children as well. That's great. Yay, I love that. I mean, I am of the same mindset. There is a time and a place for medication everywhere, but there is certainly something to be said for thinking about not having a dependency on some chemical that you're putting into your body when there's all these other options out there.
Let's try to treat it naturally first. And if we can't, then there's other options. And I'm all for going to the doctor. Let's get a big picture. Let's see what's going on and try to address it with what way makes sense for the patient.
Absolutely. Well, Dr. Durning, I'm so happy to have had this time with you. So I think that's how Mr. Rogers ends his show, when he had one. But I won't make you sing, but I do really appreciate your time. I think it's so great that you're here in St. Pete, Florida. We'll have all the information of how to get in contact with you in the show notes. And I wish you a safe and healthy 2021.
Thank you. You too.
Thank you so much.
All right. Take care.
So don't forget, if you mention that you have seen the show or listened to the podcast, Thai Technology, 3 months for free.